All right, everybody, we are ending our series. We have one more video after this. So, we're going to be talking about multiple sclerosis. When you think about multiple sclerosis, just think about lesions that are happening in the brain. This is an inflammatory disease and characterized by plaques, visible brain lesions called plaques. And, MS plaques can vary, they're typically symmetrical. They tend to affect areas of white matter, which is adjacent to the brain's ventricles. And that is what you might typically hear of in terms of vision disturbances, muscle weakness, as well as cognitive deficiencies. So that is just a little bit of an image. These are the lateral ventricles, as you can see right there. When we look at it from a neuron perspective, so in multiple sclerosis, what's happening is that it's an attack on the myelin sheath. Myelin sheath is a protein-rich coating. It's a really important coating that insulates neurons. And whenever something destroys the myelin sheath, it leads to impaired neuron function. The neurons aren't able to function properly, which can eventually lead to cell death, right? And so it's actually a really big deal. Whenever there's neuron death, that causes some of the visible lesions called the plaques from what we saw previously before. And so essentially the immune system is mistakenly attacking the protective sheath, and that's disrupting the flow of information within the central nervous system, causing the symptoms that you would normally associate with multiple sclerosis. There's a number of different types of multiple sclerosis that we're not going to get into, but I already mentioned some of the physical symptoms: the muscle weakness, the difficulty with coordination and balance, the numbness or the tingling, the pain, sometimes blurred or double vision, cognitive issues with memory, attention, or problem solving, sometimes leading to some emotional symptoms like depression or mood swings. The exact cause of MS is not exactly known. There is some thoughts that there is some genetic susceptibility, but typically having a family history of MS or certain infections does make patients have a higher risk of developing MS. It is diagnosed on a combination of medical history, neurological examinations, going to use MRI scans to also diagnose as well. There is no pure cure for MS. And in terms of lifestyle management, as a clinician, you're always going to want to encourage the clients for regular exercise, a healthy diet, and as well as some stress management techniques. And so that is a little bit of an overview of multiple sclerosis.